Clarice, I'm so pleased you've been able to join me for a Corona conversation. For people who don't know who you are, could you tell us who you are and where you're speaking from in the world today?
Sure. Well, I'm Clarice Madruga. I speak from Brazil, Sao Paulo, Brazil. I'm a researcher. I work at the Federal University of Sao Paulo at the Psychiatry and Psychology Department. And I work with drug use, mostly with epidemiology and stats, surveys, and other clinical trials, some of them here in Sao Paulo. And I think that's it. Yeah.
So for lots of people watching this, what we pick up about Brazil is that you've got a person in charge who seems to be quite Trump-like and perhaps not the most compassionate, the most compassionate human being in the world. There was something in The Guardian yesterday about the gangs in the favelas asking people to quarantine themselves after particular hours, and we thought that was a really interesting way of the community looking after itself. But my first question to you now in Brazil's most populous city is, how's coronavirus impacting you where you live and for people using drugs in your community?
Well, the pandemic is not as bad as it will be in a short period of time. We are starting the curve, so we are probably in the 6th day after the 100 case when you consider those curves, and we are going up. Despite of our tropical Trump, our president being, he's speaking atrocities publicly. He's not following any guideline, WHO guidelines, any whatsoever. But despite of that, the Ministry of Health is acting very well. So the messages are conflicting, which is horrible and confusing for the population. But at least the governors in each state, they are looking at the Ministry of Health and following the guidelines. So probably all capitals now are in social isolation and following all the global suggestions to try to avoid the peak. We have quite a lot of cases. Sao Paulo is the biggest city in Brazil and one of the biggest in the world. So we are the focus here. And we already have, I think, 40-something deaths. And the problem with looking the stats in Brazil, it's that we actually measuring tests. So it's totally biased. All the data we have about contamination, because it's to do with the testing. We are developing rapid tests. All the lack of financing that we had in the previous years with research affected, but even though we have 2 universities that are pretty much in the following week, they probably will have the rapid tests ready so we can test more people to have proper numbers, because we're not looking at any reliable numbers for now.
What's happening on the ground for people who may be now seeking drug treatment or who are in drug treatment? Are the health ministers ramping up the availability of drug treatments and needle syringe, for example?
We don't have injecting drugs problems here. Our main problem is crack cocaine use. They smoke crack cocaine. So there's pretty much no heroin use in Brazil because crack cocaine is so cheap. So that's at least we have that relief that we don't have transmission of. It's not as easy to transmit, but it's still the crack cocaine community. They are pretty much all of them in homeless. I don't know if everybody have heard of Sao Paulo's Crackland. It's quite famous by now, unfortunately. I've been studying the profile of users at Crackland for some time now. We have this year, the last survey I did in that region, we had over 16,000 people using drugs in this specific place at city center.
And I'm assuming very often people using crack cocaine will be sharing pipes, but also crack cocaine's pretty diabolical for your lungs.
Exactly, they are the most vulnerable. Yeah. Our rates of tuberculosis, it's huge among this population.
So
because
so coronavirus is just going to be another respiratory condition that's already going to hammer an incredibly vulnerable group who
yeah.
are already at risk.
Yeah, and all the services, I'm very into all the services in that region that are doing harm reduction with those users. Unfortunately, this last government in Sao Paulo, they're not being very keen on keeping the services at the area where the users are. For some reason, they think if they put the services, the drug treatment services apart, they will manage to spread the population, which is not true, because all the research we do, we find that they are there for the availability. PCC, which is our criminal organization, the one that is providing crack cocaine for this community, they won't move. So as long as they're there, they're not going to go anywhere else. But because of that decision, we have less services available in that area, which is very bad. We used to have 5 or 6 big services centers around that region. Now we only have 2. And they are from the state. And they are already trying to get prepared. I spoke to Claudio, which is the director of the main one that is in the epicenter of the drug use scene, the crack cocaine use scene. And he said he has already a floor prepared, but no respirators. They couldn't get hold of any equipment. So they are just going to do as much as they can without having a proper, intensive care unit available there. When you look at the media, there's lots of people talking about homelessness in Brazil and how hard it is to prevent and to propose social isolation, considering the favelas and all those communities that they are 10 people living in one single space. In one single room, and this has been this is as good as we can get from the governments when they mention and they consider the challenge of doing any prevention with those communities, but they don't even get to mention our problem with crack use. It's bizarre because less than 2 months ago, we released the results of this study I did in Crackland, and it was spreading all media. People couldn't stop talking about the crack cocaine problem. And now with the COVID, we just don't hear. Nobody wants to mention because there's no solution for that. The same way it's hard to deal with the communities and the vulnerable, socially vulnerable people in the favelas, even more for this population. But the problem is they are much more vulnerable. They're even more vulnerable than the socially vulnerable people, because they have all the lungs problems related to crack cocaine use. So unfortunately, there are no initiatives, specific initiatives to try to look after this population. There was some rumors that they would suggest the homeless to move to areas in Rio de Janeiro. There's something on TV the other day. I don't have that information as official. I had it from the media, but the government was considering to use the Navy boats to be in Rio de Janeiro to receive all the communities for this meantime where the peak is worse. So it would be more possible for them to do any sort of prevention, which is weird because if they get infected in a boat, it would be even worse. It's Brazil. It's very complicated. It's Brazil in all senses, because the middle class and the higher classes, they are following very well the isolation. Businesses are closed. We have the complete lockdown in Sao Paulo. But we know in the favelas, they will be there, just without work and without income. And that's not going to last. They stay in there because the public transport is limited. All the circulation in the town, there's no services happening. So there's people talking on TV how big is the problem with the homeless that depend on begging in the city center. They're starving because there's no people there. And it's not going to last, because they will have this huge problem of not having any sort of assistance and they go to the street. They will go to the streets and try to use any service that's available, and have agglomerations. Like we see already in some cities, people reunited in front of hostels or reunited in front of places that they receive food. So it's very hard to deal with that.
Bringing the most vulnerable people together because there's a service, and that adds another. It sounds unbearable. Exactly. Tell me, are the police doing anything different? Are the police backing off arresting people? Are they deprioritizing drug use?
No, they deprioritizing.
They are.
Lots of police in Sao Paulo, but it has a huge security services. We have 3 different police types: the military one, the civil one, and they are actually trying to monitor the agglomerations, but they're not enforcing yet anything.
So that's quite a positive thing. They're not going to compound these problems, because I guess we don't want very vulnerable people in prison at this time.
I know, yeah.
Prisons will be another terrible environment to be in.
Exactly. Actually, in Rio de Janeiro, there was something on the news as well saying that they changed one of the legislations, so they won't be putting inclusion minors. Now we have those houses for small crimes or all crimes committed by underage, and they stopped every attempt to enclosure these people with a reason. Yeah.
I mean, that sounds like quite a positive.
Yes, it was amazing. Yeah, I was amazed when I heard. I didn't hear anything similar in Sao Paulo, only in Rio de Janeiro. But when one big capital does something, especially if it's here, South and Southeast Brazil, it's very likely that everybody's gonna do the same strategy. So very soon, I think they will do something about preventing people to go into jail. And some specialists are mentioning on the news the need of releasing some of, we have overcrowded prisons in Brazil. It's a massive problem already. And we see specialists mentioning it and saying how important it is to do something about it, but nothing has been done yet.
It's beyond difficult. The idea of that entire population being locked down, who are then effectively going to be starved because there's no sources of income, because there's no one on the street.
Exactly.
Where you will be in a couple of weeks' time sounds really scary. And the fact that the government's not putting those other resources in place now, for those people who, are among the most vulnerable, always.
Yeah. They are the vulnerable among the vulnerable.
Yep.
And there's quite a lot of pressure for the president to put in place some measures to provide assistance to a minimum salary, or we have here the benefits, the family benefits that we call. So they already announced that they're gonna be releasing quite a lot of more inscriptions or subscriptions to start to provide this type of benefit, and that will help a lot with those communities, but probably won't reach the crack users being homeless, because they cannot be organized enough to go after and search for that type of assistance. So it's probably not going to be enough for them.
Oh, look, my heart goes out to you guys there. It sounds super hard. Like, we've spoken to people in Mexico, other people, in the UK and in South Africa seem to be in a much better position. It sounds super hard. So
yeah,
Clarice,
we're overpopulated, and that makes everything harder with the gap, social gap, and overpopulated. It's a massive problem.
Yeah. So Clarice, I'm going to leave it there. I know you've got small people to keep an eye on at home. Thank you so much for taking the time for sharing a small glimpse of what's going on in Brazil. And we'll probably come back in a couple of weeks when my guess is that you may have a different story to tell.
Yeah.
But I think it's really
not
important.
As bad as we think.
Yeah. But until then, please stay safe, look after yourself, and we'll be in touch.
Andrew, thank you
All
very
right.
much. Take
Cheers,
care.
Grace.
Bye-bye.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine.